This video is the first of two parts to describe the use of spinal cord stimulation to relieve chronic intractable pain that has not responded to any other techniques. The pain usually, but not always, originates in the spine, but sometimes originates in the hands or the feet or other body parts. The idea of spinal cord stimulation is to place electrodes somewhere between the pain and the brain. The purpose is to send signals both down and up the spinal cord. The downgoing signals interfere with incoming pain signals. The upgoing signals are felt in the brain, like a gentle tingling typically. The kinds of pains that we're talking about have not responded to more conservative care, such as time, medication, therapy, injections. In some instances, even surgery has failed to relieve pain. And in some of the most unfortunate circumstances, surgery has actually made the pain worse or has been the actual cause of the pain. In any event, spinal cord stimulation is generally considered a treatment of last resort for these kinds of pains. In a sense, we're using a device that resembles, in some respects, a pacemaker, but we're using it in order to trick the brain into feeling tingling instead of pain. The protocol involves three stages. The first stage is a required psychological screening. The purpose of the psychological screening is not to determine if a patient has a psychiatric illness or not. It's actually irrelevant whether someone is depressed or schizophrenic or bipolar or any other psychiatric illness. The purpose of a screening, of a psychological screening, is to make sure that the patient understands why he or she has the pain and understands what the spinal cord stimulator can and cannot be expected to do. The second stage of the process is called a trial of spinal cord stimulation. As the word trial would suggest, it is the temporary placement of electrodes into the spine. The purpose is to first locate or demonstrate what would be the best location for the stimulation in order to relieve pain. And the second purpose is to ascertain whether the stimulation will actually relieve pain for the particular patient. Assuming that the patient gets a good result, in my practice, approximately 90% of patients who receive a trial of spinal cord stimulation get relief of enough pain to make it worth their while. After a successful trial, a patient is then sent to a neurosurgeon for a permanent device to be implanted. The details of these techniques will appear in the next video.